Late Night Health continues with our regular contributor, Dr. Paul Corona. He is a practicing doctor in the Orange County area. He's written a series of books. It's a trilogy called Healing the Mind and Body. Dr. Paul, welcome back to Late Night Health. We are going to talk today about bipolar disorder. Is bipolar disorder a disease or a condition? What is it actually?
Well, it's actually a disease state, and it's a pretty severe condition, and it's about at least 10% of the population suffer from this. So it's much more common than most patients and, frankly, most doctors realize.
And what is it exactly? Is it a chemical imbalance? Is it a genetic problem?
It's genetically based, and it is a chemical imbalance. But the key, what leads to it is genetic predisposition. So everything I do is based on history. And when I take a history of someone with bipolar disorder, we see what they call a loaded family history, meaning there's often a history on both sides of the family of depression, addiction, suicide. So there's definitely a more robust, we call a family history, than someone with a milder form of depression.
With somebody who has bipolar disorder, we hear a lot about them in the news. Robin Williams comes to mind. Historically, they say that Abraham Lincoln had bipolar because he was known to have huge lows and then also huge highs.
Right.
Is that? Do you think that that's true? That a lot of people who are in the limelight have this disorder for some reason. We don't, Yeah,
and recent ones that come to mind: Amanda Bynes, probably Britney Spears, and there's a lot of people in history, and a lot of great artists and inventors and politicians, and a lot of very prominent people suffer with bipolar disorder. A lot of people with bipolar disorder are very, very intelligent, highly intelligent,
and creative.
What's that?
And creative,
and highly creative, but become dysfunctional when these episodes hit, when they get very highly manic and then very depressed. And when you mentioned Robin Williams, who had bipolar disorder as well as ADD and well as addiction, that was a bad combination, leading ultimately unfortunately, to his suicide. And suicidal rates are also quite a bit higher in bipolar disorder than other forms of depression.
I mean, that number, 1 out of 10 people,
right,
have bipolar. Is it? Do we know what causes it? I mean, it's genetic, but is there a specific cause?
Well, we think genetics is the main cause of it. Sometimes situational stressors will set it off. Traumatic events might set it off. Age can be a factor. It tends to be more common or more predominant during changes in hormonal balance in the person.
So andropause or menopause.
Menopause or teenage years. But when we take a history of someone with bipolar disorder, there's usually a stronger history starting earlier in life, erratic history of ups and downs, cycles of mood over time. So it's the key of what I do is taking a really good history and listening to my patients and getting really going over their whole lives and looking at the patterns and the cycles and the seasons of change.
One of the things that sets your practice apart is the fact that you talk to your patients, okay? Most practitioners today spend 5 minutes and then they're done, right?
He is not only talking to my patients, but listening to my patients and actively listening and not just trying to speak doctorese to them, but actually just letting them talk and letting them, and that's the best information I get is just from listening intently to my patients.
When somebody has bipolar, can they be productive in society? Certainly, you mentioned Amanda Bynes and Britney Spears, Robin Williams, Abraham Lincoln. Those are 3 or 4. But are many people not capable of being productive?
It depends on what phase of they're at, and it depends on if they get treated. I mean, it's a very, very treatable condition. Unfortunately, in our modern world, there's a lot of anti-medication mentality out there. A lot of people just refuse to be treated, or just I'm not a pill person. I'm not going to take pills for things like this. And those are unfortunate people who just won't get better. But I think like with any mental condition, there's phases of it, and I think that a lot of people are highly productive, and then when some people when they're manic are extremely productive, and actually more productive than other people. The problem is when they hit the depression and become dysfunctional, have difficulty getting out of bed and getting to work. So there's a lot of erratic history as far as loss of jobs, loss of relationships, because bosses and significant others just won't put up with this over time.
What we would call a craziness of a person.
Right.
What about levels? I mean, that's what I think you were alluding to. You can be pregnant, but you're 100% pregnant, right?
Right?
You can't be a little bit pregnant. There's no such thing. Can you be a little bit bipolar?
Yeah, and there's there's basically the majority of bipolar. When people think bipolar, they think of the craziness. They think of the erratic behaviors caused by the mania, which the psychotic type of thinking and behaviors. But the vast majority of depression is spent in depression, and the depression can be very deep and very dark. So this is why some people have just milder forms of depression, and some people don't get a full-blown mania. They get what we call hypomania, or lesser states of mania.
There's another word you used off the air, and that was unipolar disease. I had not heard of that. What is that?
Unipolar is milder form of depression or anxiety disorders. We call it, where they spent most of their time in either a depressed state or an anxious state. Whereas with bipolar, meaning two poles, basically it's a cyclical nature to their mood, and they have the ups and downs, and it's, like I said, it can be difficult to be around people like that or living with people like that.
Our guest is Dr. Paul D. Corona. He's a regular contributor here on Late Night Health. He's the author of Healing the Mind and Body, books 1, 2, and 3. And we are talking to him today about bipolar disorder, bipolar disease. You mentioned something about that it's easy to fix. It's easy to, I guess, prescribe for bipolar disorder. But my understanding is that compliance is what gets in the way. It's not so much that people don't want to take pills. There's a show that I've been watching. One of the featured players is a bipolar late teenager, maybe 19 or 20, and he gets off his meds, and he says, because the meds don't make me feel like myself.
Yeah, and then you're right. Compliance. First off, it's fighting the whole pill issue to begin with, and a lot of people just won't come in to see me or another doctor because they just write off pills as a solution. And it's not that it's easy to treat. But it is treatable. It typically takes a combination of medications. But the foremost are we call mood stabilizers, which can help to really even things out. The problem is with some people with bipolar disorder, they like the mania, they like the ups, and they like the highs, and they don't want me to take their edge away. And so I got to be very careful with medications to not get a person to feel dull or apathetic. So they feel functional, but they feel in control. But that's the tricky part with medications.
So that's going to take a while to adjust those medications so that they're not doing something that could endanger themselves or others.
Right. And
at the same time, they still feel in control.
Right.
So it's a balancing act that you, as a physician, need to do.
I usually have to put in an antidepressant as well as a mood stabilizer. And some of these patients are on about 3 or 4 different medications to really get a good balance and good control.
Wow. And I suppose the more severe the problem, the higher the dosage.
Higher the dosage and the more medications. And sometimes it's simple, And like I said, there's the 9 out of 10 patients with bipolar disorder do not have what we call bipolar 1 disorder, which is the most severe variation that people think about. 9 out of 10 have lesser variations, but it's still more difficult to treat than unipolar depression. And
how does that manifest? The lesser of the evils, if you will.
Lesser of the evils meaning they're not quite as erratic. They're not quite as you say, crazy. They don't, with mania it can be, very erratic and irrational and paranoia, and the FBI is after me, and they get highly paranoid state. Sometimes they even hearing voices and seeing things. But
we talked about the young pilot a few months ago, who ran his plane into a mountain, killing everybody on board the plane. It would seem to me that he had highs and very, very low lows.
And we talked about this before on that show that I looked over all his records on him, and he had what looks like bipolar disorder. It wasn't. They basically said he had depression. Well, that's part of the disorder, of course. But I think at that time he went through a psychotic episode, and that's my best guess of what happened, unfortunately.
So that if somebody is bipolar, a situation can trigger something to worsen the situation?
Yeah, a traumatic event, or if someone has PTSD and is from the war or from something else, and then is exposed to something that reminds them of that. Yeah, something like that could happen to trigger it.
And what about, again, just not taking the drugs because it makes me feel different? It doesn't make me feel like Mark. Right. I am not bipolar, by the way. Okay, but I mean, it's just. On the other hand, we do have the insane Daryl Wayne.
Yeah, let us be the judge, Mark. Of,
I'm sorry.
What your situation is.
Well, that's a very good point, Daryl. Can a person
don't self-evaluate?
No, yeah. Can a person self-evaluate, or if somebody feels, I feel fine, I'm acting normally, but they're not by our social mores.
Right. And the best source of information is to get it from a family member or a loved one, because the person could say to me, "Oh, I'm fine," because some people who are bipolar think they're totally fine. They don't see where the problem is, whereas they cause chaos around them, but they don't see it. So when I talk to a spouse or a family member, I get a lot more information from them often, because some people are poor historians, especially men, and men are not very good at self-evaluating.
Absolutely. We don't like to go to the doctor.
Right.
We just don't. Are more men affected or more women with bipolar?
A little bit more men than women.
A little bit more men than women.
Yeah.
All right, we're going to take some time out. We'll come back. Our guest is Paul D. Corona, the author of Healing the Mind and Body. We're talking about bipolar disorder, bipolar disease. And we will continue that in just a couple of moments. In the next couple of weeks, we'll be talking with Dr. Harriet Davis, the vegan bikini doc, and PETA's Sexiest Vegan Next Door. She just won that award. We'll be talking to her in the next few weeks. I'm Mark Alyn. Late Night Health continues. Don't go away. More coming up.